You are observing a medical student take a history and examine a 79-year-old man who presented to the emergency department following a syncopal episode whilst walking upstairs. The medical student reports that on examination, he believes the patient has aortic stenosis. Which of the following is not a typical feature of aortic stenosis? Options are A. Collapsing pulse, B. Narrow pulse pressure, C. Non-displaced heaving apex beat, D. Reduced or absent second heart sound, E. Ejection systolic murmur. Answer is A. Collapsing pulse. Clinical features of aortic stenosis: classic triad, breathlessness, chest pain and exertional syncope. Pulse, slow rising small volume with a sustained peak, pulsus parvus et tardus. Cardiac impulse, sustained heaving apical impulse with a precordial thrill. Laterally displaced apex beat indicates onset of heart failure. Auscultation, harsh systolic ejection murmur second intercostal space left sternal edge and radiating to the carotids, single second heart sound in moderate AS, paradoxical splitting of S2 or obscured by murmur in severe AS, fourth heart sound, gallop rhythm. A 57-year-old man presents to the emergency department with a history of chest pain radiating to the left arm. He is now pain-free following intravenous morphine, sublingual GTN and 300 mg aspirin. He has no past medical history or significant family history. He is an ex-smoker of 10 years. His observations are heart rate 89 beats per minute, BP 136 by 73 mmHg. RR 18 breaths per minute and oxygen saturations of 98% on air. His chest radiograph is normal. His ECG shows a normal sinus rhythm with inverted T waves in leads 3 and AVR. A troponin sample taken at triage is positive. What is the recommended next step in the management of this patient? Options are A. Repeat a serum troponin in 3 hours. B. Repeat ECG in 30 minutes. C. Apply oxygen via face mask. D. Consider discharge having ruled out non-ST elevation myocardial infarction. E. Give subcutaneous fondaparinux. Answer is E. Give subcutaneous fondaparinux. Given the patient's age and risk factors, he is not low risk as defined by any validated cardiac scoring system, heart, EDACs or TIMI. Despite the normal ECG, T-wave inversion is a normal variant in 3 and always present in AVR. It would be recommended to consider a diagnosis of NSTEMI given the positive troponin result. Initial drug treatment for NSTEMI. Aspirin. Offer aspirin as soon as possible to all patients. Initial loading dose 300 mg and continue indefinitely, 75 mg daily, unless contraindicated by bleeding risk or aspirin hypersensitivity. Antithrombin therapy. Offer fondaparinux to patients who do not have a high bleeding risk, unless coronary angiography is planned within 24 hours of admission. Offer unfractionated heparin as an alternative to fondaparinux to patients who are likely to undergo coronary angiography within 24 hours of admission or in renal impairment. A 64-year-old man presents to the emergency department with a 2-hour history of central chest pain. His ECG shows ST elevation in leads V5 to 6, I, AVL. He has a past medical history of peripheral vascular disease and poorly controlled type 2 diabetes. He is a current smoker. The nearest primary PCI center is a 1-hour transfer away. Which of the following definitive management plans is most appropriate? Options are A. Aspirin 300 mg stat and emergency transfer for primary PCI center. B. Aspirin 300 mg stat and low molecular weight heparin. C. Aspirin 300 mg stat and fibrinolysis. D. Aspirin 300 mg stat and clopidogrel 300 mg. E. Aspirin 300 mg stat and angiography within 96 hours. Answer is A. Aspirin 300 mg stat and emergency transfer for primary PCI offer coronary angiography, with follow-on primary percutaneous coronary intervention if indicated. As the preferred coronary reperfusion strategy for people with acute STEMI if presentation is within 12 hours of onset of symptoms and primary PCI can be delivered within 120 minutes of the time when fibrinolysis could have been given.